Hi, and welcome to the Melanoma Research Foundation's 25th anniversary special guest series for March. This month's special guest series, I will be joined by Representative Kelly Cassidy from Illinois and Dr. Amy Derick from Derick Dermatology. Again, my name is Cassie Beisel. I'm the Senior Advocacy Officer with the Melanoma Research Foundation. I am also a 3-time cancer survivor, one of those being advanced melanoma. 25 years ago, the Melanoma Research Foundation was founded by a patient to bring together all aspects of the melanoma community. Since then, the organization has grown dramatically with the patient journey at the heart of our mission, and we are proud to be the voice of the patient. We understand the challenges this disease brings to patients and their caregiver, which is why the work that we do is at the very heart of the patient. As Senior Advocacy Officer, I work with melanoma patients, caregivers, and their loved ones to help create better outcomes for the melanoma community. Over the years, advocacy has continued to drive access to groundbreaking research, healthcare, and better outcomes for melanoma patients, survivors, and care partners across the United States. Now I'd like to introduce 2 amazing women that we also honored at the 2019 Chicago Gala and have worked closely together to ensure access to skin screenings for those living in the state of Illinois. First, I'd like to welcome Dr. Amy J. Derick, MD. She is the CEO and Medical Director of Derick Dermatology, LLC, an award-winning dermatology practice providing medical, surgical, and cosmetic dermatology services. Founded in 2006 by Dr. Derick, also as a solo practitioner, Derick Dermatology has grown mostly by word of mouth to serve over 130,000 patients out of 12 locations. Dr. Derick attributes the growth of the practice to high patient satisfaction. Derick Dermatology has over 16,000 verified 5-star reviews, and 98% of patients say they would refer a friend. Derick Dermatology's primary mission is early detection and treatment of skin cancer, such as melanoma. In 2018, Derick Dermatology was diagnosed 317 melanomas and 3,626 non-melanoma skin cancers. 3 out of 13 dermatologists designated as top cancer docs in Chicagoland are Derick dermatologists. Dr. Derick completed medical school at the University of Chicago School of Medicine, graduating with honors at the top 10% of her class. Internship at Northwestern Memorial Hospital and dermatology residency at University of Chicago Hospitals. Dr. Derick is an academic associate member of the University of Chicago section of dermatology and an instructor at the clinical dermatology at Northwestern University. In 2015, Dr. Derick was awarded the Distinguished Service Award for Early Achievement by the University of Chicago's Medical and Biological Science Alumni Association. In addition to leadership roles as Vice Chair-elect of the American Academy of Dermatology Advisory Board and trustee of the Illinois State Medical Society, Dr. Derick has served as president of the Illinois Dermatological Society since 2013. In 2019, Dr. Derick was appointed by Governor Pritzker to serve on the Illinois State Medical Disciplinary Board. Derick lives in the suburbs of Chicago with her husband, Michael, and her 3 children, Charles, Henry, and Jane. Alongside Dr. Derick today, we have Representative Kelly Cassidy, who is not only a melanoma survivor herself, but had recently lost her best friend and grandfather to her oldest son to disease after a long and courageous fight. Representative Cassidy is currently serving, I think it was her 4th term as state representative for Illinois' 14th House District. In addition to serving as chair of the Appropriations Public Safety Committee, she also serves as vice chair of the Judiciary Committee. I have not had enough coffee, of the Judiciary Criminal Law Committee, and as a member of Human Services, Labor and Commerce, Adoption and Child Welfare, and the Prescription Drug Affordabilities Committee. Prior to her appointment in 2011, Illinois State Representative Kelly Cassidy was a community activist and organizer. She served as as the district officer director to Senate President John Coltrane and in the office of Cook County State's Attorney. While no longer an organizer by trade, Representative Cassidy continues to carry the perspective of an organizer throughout her work. As the only gay female member of the General Assembly, Representative Cassidy has helped pass progressive legislation, including criminal justice reform, women's rights, and the LGBT community. She led an effort to ban conversion therapy in the state, which was then used by a model for other states. Most recently, she was the primary sponsor of the Reproductive Health Act that affirmed an individual's right to bodily autonomy and fixed Illinois' outdated abortion law to treat abortion like all healthcare. She also led the change of passing legislation to ban for-profit detention centers in Illinois. Finally, she was the primary sponsor in the House of the bill that legalized adult use cannabis in Illinois. The law is groundbreaking and it's equity-centered restorative justice focus that aims to address the issues brought upon communities and individuals most directly impacted by the war on drugs. This new law is now being looked at by the jurisdiction across the country, seeking to model the restorative justice and equity components that were worked into law. Representative Cassidy has for 2 decades worked tirelessly to make government work for the people it represents. Her unique experiences, dedication, and passion for her constituents drives her focus on serving not just the people of the 14th district, but elevating the voices of communities with little power across the state. Representative Cassidy and Dr. Derick also worked closely together to pass no copay skin screenings a couple years back in Illinois, being the first and only state to offer no copay skin screenings to Illinois residents. So without further ado, Dr. Derick and Representative Kelly Cassidy, we welcome you both here for our Q&A for our special 25th series. Good morning, ladies.
Good morning. Thanks for having us.
Absolutely.
Good morning, Cassie.
Good morning. So first, let's just talk, have a little fireside chat, if you may, with the both of you. So if you would both, Representative Cassidy and Dr. Derick, kind of talk a little bit about your personal passion behind your roles, Dr. Derick, yours in dermatology, and Representative Cassidy, yours not only in public policy, but also your keen interest in skin cancer.
Sure. Go ahead, doctor.
Okay, so I founded, after completing my dermatology residency, Derick Dermatology in 2006. And at that time, when patients would come and see me, if they had a melanoma and it went undetected, they most likely would not survive that. And so one of my core values is owning it, high accountability. So I felt a lot of accountability when people would come in to the office that if they had any sort of skin cancer, that I had a duty to find it. And so I ended up kind of focusing on the detection of skin cancer. It was very rewarding. At that time, if you didn't have a melanoma detected, you would likely go through immunotherapy, interferon therapy, and then probably would not make it. And I saw people who were in their 30s, females with young children, suffering for many years, and then passing away, leaving their children without a mother. And it was very very important to me that we would detect skin cancer as early as possible. Fast forward, to maybe 2012 or so, we found that if melanoma did go undetected, there were other options such as immunotherapy. And even though it's much better to have that option, and people are doing very well on it, the outcome is not as good as if you had caught it early, and it's incredibly expensive in terms of therapy. So it is much more cost effective and life-saving to find skin cancers early. And so we kind of focused in our primary metric of success at our office is, we call it lives saved, which are melanoma detected. So we hold each other accountable for finding melanomas on the patients that we see, and making sure that we catch them as early as possible. We've been very successful doing this. I think last year with COVID and the pandemic, unfortunately, not as many people have been coming out for routine skin cancer screenings in general. But I'm hoping that as life comes back to normal, and with sessions like these where we encourage people about the importance of doing this regularly, especially if you're a melanoma survivor, and in Illinois with Representative Cassidy's amazing law that makes this, accessibility to skin cancer screenings very easy. I think that we will get back on track with the number of melanomas that we're detecting.
Right. For my part, public policy, public service has sort of driven me from the beginning. I joke I'm one of 7 children and 5 of them are teachers. And so I took a different path. But I believe that the work that we do does more than just, you pass a law and it's out there in the world. It really is about what happens afterward. And Dr. Derick, after we passed the screening bill, I would get emails from her or from her colleague at the Medical Society when she would find what she calls a Cassidy save. And honestly, our work can be really, really hypothetical, and knowing that we've touched a life is huge and sort of feeds that battery that you need to keep going. I grew up on an island, a barrier island in Florida in the 70s, where if you put anything on your skin when you went outside, it was baby oil. And so very early on, it was very clear to me that this was going to be a part of my life. My mom had multiple basal cell removals and ultimately did have a melanoma. And as you mentioned at the beginning, my son's godfather, my best friend, passed just the week before the Chicago Gala. And he did everything right. I have instilled in my kids that this is just like getting your eyes checked, getting your teeth cleaned. This is part of that preventive maintenance that's required of the machine that is our body, right? And at one point, right before 2019, when I called to make my appointment, I was seeing a different doctor then. I'm now a patient of Dr. Derick. But when I called to make my appointment, the receptionist read from a little card to remind me that that there would be a copay, and that this was not considered preventative. They had this whole spiel down, and I had never heard it before. When I saw the doctor, he told me that they were getting complaints from patients who thought that all cancer screenings were copay free. And I thought, there ought to be a law. And so working with our medical society, I was connected with Dr. Derick, and we found the path for Illinois to have that copay taken out of the mix, because it does make a difference. And in particular, Dr. Derick mentioned, the impacts of COVID and the lockdown. Lots of folks have been hit hard in the pocketbook and in the insurance area as well. And so making sure that we continue to make it possible for folks to access care is critically important. When lockdown first lifted in the summer, I got back on track and went in and had my most recent Mohs surgery at Derick Dermatology. And we joke that this one was the removal of my unicorn horn, because it's right in the middle of my forehead. But I'm grateful to have access to that kind of care, to know that I can stay ahead of this. I can stay on top of it. My legacy of the beach as a beach baby does not have to have an unhappy ending.
If I could just say about these Cassidy saves, it brings tears to my eyes thinking about them, and I love sharing them. And there are more of them that I've shared, but 2 that come to mind are one rural young woman came and had the benefit of a skin cancer screening, and we found a melanoma that was like right on the cusp of when she would have needed a sentinel lymph node biopsy. The increased risk was dramatic, and we caught it right before, and we were able to cure it with an excision, which is phenomenal. She didn't know about it. She didn't see it. We were very thorough in our exam, of course, and found it, and it was just like 0.1 away of requiring more severe interventional treatment. And the other one is a patient who was 6 months pregnant and came in for a Cassidy skin cancer screening and found a melanoma. And during pregnancy, the estrogen can really make melanomas more aggressive. And also there's risk to the baby too, that it could metastasize to the baby as well. And so I am confident that, she would have waited 3 more months had this not been something she became aware about. And because it was no cost to her, she did the skin cancer screening. We found the melanoma, it was removed, and everyone's doing fine after that. But these laws do increase access to things that are life-saving, and it's the most rewarding thing that I do in my job is related to skin cancer detection, early skin cancer detection. And I think that when you put faces and names to these stories, it's really, really quite special. So I'm very appreciative to Representative Cassidy for allowing more people to have access to life-saving dermatological care.
Thank you so much for that. And that is absolutely right. I mean, melanoma and other skin cancers are very time sensitive, just like all the other cancers out there. And without early intervention, it can just go a completely different direction that nobody is prepared to see or prepared that they would ever have to live through. So I think that's absolutely correct. Let me ask you this. So, we talked about the importance of the Cassidy skin screenings, and I love using that term. So why are annual and sometimes biannual skin screenings so important? And to follow up on that, secondly, what are some of the possible implications of not checking your skin monthly, privately, or yearly by a board certified professional?
I think it's really a time game. When you haven't seen your skin, if no one's looked at your skin with 2 years, then something could have been there for a year and a half and growing, metastasizing, et cetera. And so the more frequently you have someone who's looking at you, the more likely you'll find it earlier. And looking at yourself is important too. Looking at your partner, spouse, children, as well as important. We have, I don't remember the exact statistics, but partners are very likely to find melanomas on the backs of their partner. And so I think it's important to not only look at yourself, but look at whoever you live with. And professional eyes, looking at your moles with specialized light is important as well. And so if you have any risk factors for skin cancer, it's even more important to regularly see a dermatologist or a dermatology practice to be able to have these moles looked at with professional eye as well.
And I'll add, part of the desire to make this more accessible is, as I said, like raising my kids to know you get your eyes checked, you get your teeth cleaned, you get your skin checked, like routinizing this and making it, just a maintenance stop is so important. And to Dr. Derick's point, knowing what your baseline is critical, both having a doctor who knows what your baseline is, but knowing, hey, what's that spot on your back, babe? That is, that looks like it changed. That paying attention is so important in this sphere.
Absolutely. I agree 100% with that. And I think if I would have paid attention earlier on, I maybe would have never worked for the MRF because they really helped me out during my advanced cancer. But maybe it wouldn't have gotten advanced if I had known what to look for, knew it was a thing, and knew what the outcome of advanced melanoma would look like. And I think a lot of people might change their minds if they saw the latter part of the outcome if you don't get your skin checked. So let me follow up with this question. So, why is it important to ensure that all Americans have equitable access to skin screenings? Why not just a few or some that are maybe in the most, like some of the areas like Colorado that are a mile high and can be, have the most diagnoses per year? Why is it important for everyone to get their skin checked and have access to that?
Well, to the point of, whether you're in Colorado or Florida, as I said, I grew up on an island in Florida. I now live in Illinois where, our number of days of sun a year are very, very different than what I had in Florida or what I experienced when I visit Colorado. So, the skin is the largest organ of the body. Everybody's got plenty of it. Everybody's got a great risk. And it is so preventable. It is so worth preventing. It's really that simple.
The other thing I don't think people realize is like, how does a mole, how can a mole kill you, right? It's just a spot on the skin, and how is that going to kill you? Well, what happens is when babies are developing, the skin is differentiated and it knows its skin, like the actual skin itself. Moles or melanocytes come from neural crest, which is more like primitive brain tissue. And so when a mole or melanocyte becomes cancerous, it doesn't remember it's like part of skin. It thinks it's brain and wants to move through the body, just as its predecessors did. And so when you get a melanocyte that's atypical or cancerous, it likes to go back to brain, it likes to go back to vital organs. Those growths then put pressure on the normal organs functioning, and that's why those things fail, and that's why melanoma is very dangerous. And I think the point is, obviously there's preventable things like avoiding tanning, wearing sunscreen, doing those sorts of things. But melanoma is often genetics too, and so you can get melanomas of the labia, you can get melanomas of the perianal skin, places where the sun doesn't regularly shine, and so those places are kind of by definition a little bit harder to self-examine. And so you want to, obviously prevent as much as you can, be as careful as you can with routine screening, but also recognize that sometimes melanomas will pop up in places that you don't expect, like the foot, underneath the foot. And those things can be life-threatening. And that's actually true in people with darker skin types. They often will get melanoma in areas such as the foot, and therefore it's important, and we all dermatologists know this as well, but to educate the community about the fact that people with darker skin can get skin cancer, even though they may not get sunburn in a traditional way.
Yeah, absolutely. That's a great point to bring up. And, melanoma can also occur in your eyes, which would be ocular melanoma. And, although they are different types of melanoma, they all come from the melanin of your skin. So let's see. So that was a really good, so since we're on, myths, and obviously people of color can get melanoma, and oftentimes when they get melanoma, it's found later. And so they come to a worse prognosis, obviously, if they're letting it sit, not obviously going to get their skin checked. Let's some more common myths about skin screenings and checks. So can you dispel this myth that only older people get skin cancer?
So I think the average age of a melanoma diagnosis is about 65, and melanoma typically affects men more than women. But in younger women, it's one of the most common types of cancer they will get. And it definitely can happen at an early age. We have people in their late teens. It doesn't typically happen in children, less than 18. It can happen. It has happened at our offices, but it's infrequent. But around the college age for women especially, and that is genetic as well as possibly with lifestyle factors such as tanning beds. But those tend to be, I think, more aggressive when you get them so early that it's even more important to catch those earlier. Whereas in an older person, it might be more sun-related. That can tend to be a little bit more slowly growing, but catching those early in young people is important. And Representative Cassidy and myself passionate about women, and we've got I think 90% of our staff are women, and we've had many of our staff who are also melanoma survivors, and so there's a lot of passion around this early detection of all ages, but especially making sure people know that this isn't something that you'll get when you've got Medicare. It might happen when you're in college. And also it can also accelerate, as I mentioned before, when you get pregnant. And so people who are conceiving with fertility medications or pregnant, those are times where you really want to be extra careful with your skin cancer screenings, because the estrogen does drive the melanocytes to be more active. That's why you also get like the dark mask of pregnancy and the dark line on your belly and everything else. It just makes those cells more active, and it's tricky because you want to make sure that you don't have to, you don't require, significant systemic treatment when you're pregnant, because obviously that's a risk to the baby in and of itself. Whereas you can very easily cut off a melanoma curatively if it's shallow enough, if it's caught early.
Absolutely. And Representative Cassidy, similar question to you. What were some of the myths that you've heard of, maybe even earlier on, that would have stopped you from getting a skin check back, like in the 90s or something? What are some of those common myths that you've heard?
For the most part, it's, folks just sort of carry the, it can't happen to me, I'm too young, or, I always wore sunscreen or things like that. And I've done all of those things. One of my kids had their first excision when they were 12. You know, it turned out everything was fine and it ended up being normal, but it was that first moment of, you know, boy, he's getting started early. You know, it is something that affects all of us. And, you know, as a member of the LGBTQ community, you know, all summer long, I see lots of guys out at Hollywood Beach here, and I worry, right? You know, we're all out there worshiping the sun, and you know, there are other ways to get that glow if you want it, that don't involve taking risks, whether it's being out at Hollywood Beach or being on a tanning bed. You know, I just kind of rock the pale. I go with that. You know, embrace the pale. But you know, for others who want it, there are other ways to get that glow. You know, not all self tanners turn you into an orange guy.
So true. That is a very true statement. Oh my goodness, that's so true. I wish I knew about some of those ways prior to going into the tanning bed myself for that preventative base. And I think that's another myth.
Right. That's a big one. I've heard that. I got to set a base. I got to set, yeah.
Exactly. I think when it comes to this, like any, and Dr. Derick, I mean, please correct me if I'm wrong, because I am not a dermatologist, but any change to the skin color through sunlight exposure is showing skin damage. Is that correct?
I'm looking at all three of us. I'm thinking none of us have ever been real tan. I mean, I think that we're like white to red and back to white again. I don't think I've ever been tan. In people who can tan, it does give you a little bit of protection, like maybe a 2 to 5 SPF, which is better than nothing. But, you know, to get to that point, obviously you're causing, you know, ultraviolet radiation of your skin, which can stimulate things to mutate. And so it's not great. I think it's to Representative Cassidy's point, it's kind of like a shift into like wearing more sun protective clothing to kind of like normalize that. It happens, I think, in our kids now. A lot of our kids are wearing, because it's easier too, more of like the long sleeved sun shirts. And as time has gone on, I think more adults are choosing to do that because it's just easier. A UPF of 50 is what most sun protective clothing is, and which gives you like a lot of coverage. And then you just focus on making sure your face gets regular application of sunscreen too.
And do you recommend self-tanner?
Yeah, it's fine. It doesn't provide any protection against the sun. That's one thing that people don't realize. It's not actually like a sunscreen. Just because you look darker, it's not that your skin is acting like it's a darker color. It's like a stain. And I think this, I'm pretty sure this is true. Now I'm going to say this on Facebook Live. I'm not 100% certain, but you know, what happened was they were giving babies, cystic fibrosis babies, certain feeds, and it was had this certain component in it, certain chemical. And if they vomited on their skin, it would stain their skin a certain color. It was like a brown. And so they figured out what that was and, you know, package it. And now that's what sunless tanner is.
Amazing.
But I like it more of like a direct application. Sometimes you can go in a booth and it like, you know, it sprays all over you and you inhale that. I don't know if it's definitive. It seems better to me not to breathe that stuff in, but I don't think it's necessarily bad. But we haven't, to my knowledge, there's not really any issues with it's just basically like dyeing your skin a little bit darker, and that's it. But it is important to recognize that does not mean you have, you know, slightly darker skin color in general. It's just, you know, like makeup, but it's, you know, more of a stain.
Yeah. Well, that is a fun
Be like
fact.
us. Embrace the pale. Embrace the pale.
Exactly. And I would say that we agree with that. Embrace the pale. You know, there is the stigma about, you know, a healthy glow and et cetera. And I know that, you know, a lot of people, you know, live by that motto, but the healthiest version of you is to be exactly who you are and exactly embrace that pale. So I'm 100% agreed with that. So knowing that we just have a little bit of time left here, I wanted to ask, you know, so do we, you know, you guys have already kind of given a message to communities out there about tanning, et cetera, but do you have any kind of last words of wisdom that you wanted to talk about, either a message to those who take an active role in approaching tanning, or, you know, leaving us with a message of the importance of lending your voice to better outcomes? Because, you know, even though, you know, Illinois, we get the Cassidy screenings, I'm going to use that term over and over again. You know, there's, and I just lost the train of my thought, but I'll leave it at that and I'll let you answer those two questions.
So I think that, you know, the biggest thing I would say to everybody who, especially those of you who are not in Illinois, you know, call your lawmaker and present this as an option. and talk about your personal story, whether it is your own survival, whether it is having lost someone. Those real stories are what actually help drive policy change. It's very easy for lawmakers to, sort of put something in a box that doesn't really attach to a human. It's just a theory. But when there's a person there sharing a story, sharing an outcome, it gives us as lawmakers an imperative to pick up that mantle and carry it. And so I encourage folks to share their stories of survival and ask their lawmakers to help them help others survive.
And I just want to, again, thank Representative Cassidy for her passion to get this law put through. It saved our patients' lives and increased access to the life-saving care that we provide. And I know that I have been willing to with other states to be helpful, and I know Representative Cassidy would be willing to be helpful as well with these initiatives in other states. It's been successful. Unfortunately, the data from last year is going to be skewed because of the pandemic, because the minute it was enacted. So I don't think we'll be able to see the full impact until we are back into normal terms. But I think that the not only is this life-saving, but it's much more cost-effective than having someone let things go and then having to require very, very expensive treatments. It's like $500,000 per person per year sometimes for some of these medications. So with that in mind, I think that it's a compelling argument to increase access, and so far our patients have loved it. And it's just to be clear, it's in commercially insured patients. It's not for Medicare patients or that sort of group of federally funded healthcare plans. It's more for the people who have commercial insurance, and so there's some stipulations with that. But I think that it's been very impactful to our patients, and I want to thank her and thank the Melanoma Research Foundation for being the voice of patients with melanoma, and for the doctors who care for patients with melanoma. So thank you.
Absolutely, thank you. And I ditto your thanks to Representative Cassidy for that as well. It's one giant step, and a lot more steps hopefully to come. And
yeah, our work isn't done. We know that.
Our work is not done. And as you heard both Dr. Derick and Representative Cassidy say, if you are in a state and you are interested in this, let us know. We're happy to work with you to make this happen in your state if possible. You can just reach out to me at the Melanoma Research Foundation, and we can start that way. There are a couple of questions that I wanted to ask you guys before. I gave you the rest of your days back, although I would love to keep you on forever. But this one is for Dr. Derick. What are your thoughts on genomic testing for melanoma?
I think that it's difficult in some regards because the results are not definitive, and so it requires the moles to be cut out anyway for pathological diagnosis. And so it's like ancillary information. It's very expensive, but sometimes just removing the mole, looking under the microscope the classic way is better in terms of making certain that you've removed it and that it is what you think it is. I think in the future probably that will be more of a consideration or more widely used, but right now it kind of is like a gray area thing where you're like the risk is very high if you're wrong, and the actual cost in terms of like the money or the actual small removal of skin with a tiny scar, it seems to be like a little bit more worth it to be more conservative in that regard. So stay tuned with the genomic testing. It's ancillary supplemental information right now, but I wouldn't depend on that as the sole mechanism to say something's benign or not.
And then this is for both of you, and whoever wants to go first, feel free. But so I guess the question is, for you, Representative Cassidy, were you scared to go get your skin checked for the first time? And what would you say to those who might see something but tend to want to ignore it based on what they think might happen? Like they don't, they know somebody who has had a melanoma, gotten it cut off, left a really big scar, and so they just would pretend, they would like to pretend it's not there and move forward. What are your thoughts and words to that?
So I was pretending something wasn't there, and my internist on the way out of I was there for like a stomach bug or something, and as he hit the door, he turned around and he said, "I've been meaning to ask you about that thing on your face." And I said, "What thing on my face?" Literally putting my hand on that thing on my face. And he happened to share office space with a dermatologist from his practice. And he was like, "No, really, I want you to see my partner now." And as it turned out, it was really deep. I ended up with a quarter-size hole in my face. that required a little extra effort to get it closed up, because it had been there so long. And it was really in that, as Dr. Derick described, somebody, they were that close to having to go, down a much different road, because it had been there a good 5 years and I didn't think anything of it. And so that was the beginning of my journey. And so I always, when I talk about this, I always, have to shout out my doc, who, did what a good primary care physician does, and noticed what I didn't bring to his attention and shared it, and made sure that I got the specialty care I needed. In terms of, being scared now, every time I go, I'm prepared, but I also know that I'm in good hands, and I know what the treatment looks like for getting it early. I know that I'm probably never going to experience digging a giant hole in my face again, because I am ahead of the curve now. And so that's what I tell people.
I think that's actually a really great question. We go above and beyond at our office to make people feel comfortable by being naked in front of other people, by doing draping, making sure that the temperature is appropriate, making sure people are comfortable on the chairs that we have, and making sure I'm very, very adamant about having all of the clothes off. I mean, if someone doesn't want to take all of it off, then that's always their prerogative, but not like lifting up the shirt and pulling up the pant legs where the clothing is completely off. We like the patients to be comfortable lying down, so that the person evaluating the skin isn't hunched over uncomfortable, because I think that accelerates the decreases the time that you're going to spend in that position. So we make sure the provider is comfortable, the patient is comfortable, and it's better to find it and take care of it than the alternative. And I think that whatever we find, we'll handle, and it's the options are much better when you find it earlier. And we do everything we can to make sure that experience is not a bad one. And so I think that's a great question, and people should not hesitate to have their skin looked at in that manner, feeling self-conscious or so forth and so on.
And there's nothing like that feeling of finishing your exam and knowing that there's nothing to follow up on. It's really like that winning feeling you get at the end of your dental cleaning, when you're like, cool, see you in 6 months, it does feel like a win every time.
Yeah, that is a great point. Sorry, Dr. Derick, go ahead.
Oh, no, I was just going to say, and if you're a skin cancer patient and you go, once every 3 months or once every 6 months, that whatever's there is not going to have been longer than 6 months or 3 months on your body. So, if you're getting thorough examinations, it's important to hold your, dermatologists accountable for doing a very thorough examination of your skin, and to also pay attention to any moles that are changing. Newer changing moles are much higher risk for melanoma, and so we always tend to be a little more conservative to sample and make sure it's okay. Cancers grow and change, and that's why the moles grow and change. And if there's a changing mole or a bleeding mole or something like that, that's like, you got to go in right away for that.
Exactly. And then, one thing we always like to say is, when in doubt, check it out. You can ask people on Facebook all day if this is something that they think you should go to the dermatologist for. But my guess is, if you're going to ask them, you should just go to the dermatologist yourself and get it checked out, because they're the ones who can find it early for you. But checking monthly, going early, going often is the best way to do it. Otherwise, you wind up with large scars, or like me, with no lymph nodes in your right arm. So it's definitely, our early prevention is one of the most important things here when it comes to melanoma and skin cancers. Well, I would like to thank you both, Representative Kelly Cassidy and Derick. Thank you all so much for taking time out of your very busy schedules to share some of your personal stories and your passion behind the importance of early skin screenings. Thank you so much for working together and within the state to pass this no copay skin screenings for private insurances. It is certainly important, and I'm sure you opened up a world of possibilities for people by doing this, and hopefully we can replicate it in other states. And I just want to say, none of this wonderful progress could have been done without, the support of the melanoma community and volunteers. So thank you all who get out there every day and advocate for change. And that advocating can also happen in your doctor's office when you see something and you're advocating for yourself to get that public check.
And one more shout out, if I could, sorry to interrupt. I want to thank Erin O'Brien from the Illinois State Medical Society. She's a tireless advocate and the person who connected Representative Cassidy to me, and is passionate about her job and does such a great job with taking care of issues such as these. So thank you to her as well. And she was, instrumental in making sure this came together.
Very much so. She's the one I called with the crazy idea, and she found the person to implement the crazy idea with me.
Fantastic. The best ideas start out with crazy ideas. So, yeah, so thank you both again. I just say, 5 years ago, there were no FDA approved treatments for melanoma. 17 years ago, there was one. It was interleukin 2 with a 6% long-term survival rate. In 2011, there was 2. It was interleukin and interferon, which I did. And today, there are over a dozen approved drugs and treatments for melanoma, which is great. But again, we don't want you to get to the point of having to use any of those, which is why going to get your skin checked often, yearly, at the very least, is the most important thing. So thank you both for providing hope for those in Illinois, and hopefully we can provide hope for everyone for early prevention in every other state within the US. And again, this is our 25th anniversary, so there's hope for the future. And if you'd like to give the gift of hope, please donate in honor of the MRF's 25th anniversary at melanoma.org/donate. Representative Cassidy, Dr. Derick, it's been an honor and a privilege. Thank you both so much. And keep providing that hope out there to everybody. We really appreciate your time.
Thank you.
Thank you both.